So I will go again. Automated external defibrillator. Now, when you're using an automated external defibrillator, in a case of cardiac arrest now, the AED is like a best friend. So the first thing to do is to turn it on. When you turn it on, you attach your pads. You attach expose make sure that you're exposing the patient chest, because you are not just attaching straight to the chest to the clothes. You are attaching directly on the chest, one on the upper right chest and one on the lower left side. Now, the third the third step is to analyze the reading. Analyze the reading of the AED. Make sure no one is touching the patient, because it is a shocker, like something that shocks the heart of the patient. So, um, if it says shock, then that is clear. You look around to be sure, then you press the shock button. Then the fifth step, you resume CPR immediately. Now, immediately you shock a patient, please do not check for a pulse. Do not check for a pulse. Then you go back to compressions for 2 minutes. Then the AED will reanalyze on its own. Now, moving on to the next slide, special situations. Now, there are special situations, but BLS is mostly the same, but there are adjustments, right? So, in this case, I listed about 5 special situations that you should do. Now, in the case of drowning, you make sure that you give 2 rescue breaths before you start compressions. You do not just start CPR before you start giving breaths, right? Because the problem of drowning started with no oxygen. So you first give the 2 breaths before you start the compressions. Now, in the case of trauma, you ensure that you use jaw thrust. That is like you thrust the jaw upward instead of held it to protect the spine, because you do not know what has happened to the spine in the case of trauma. Now, in a pregnant woman, you tilt her slightly to the left to take pressure off major blood vessels, right? So there's something called the left lateral tilt. You can check it online to know how to do this. So you do the left lateral tilt to take pressure off major blood vessels. Now, in the case of hypothermia, you undo the patient gently and give longer CPR, right? Remember that no one is dead until they are warm and dead. No one is dead until they are warm and dead. So these are the special situations that these are, I already said that BLS is almost the same, but in special situations like this, like drowning, you give 2 breaths, trauma, just trust no L teeth, analyze reading, pregnancy, left lateral teeth, hypothermia, and do gently. Now, in the case of one, let's say you are in an emergency situation and then there's one rescuer, and then in another situation there's 2 rescuer. Now, for one rescuer, you give 30 compressions to 2 breaths. Also, in the second rescuer, also 30 compressions to 2 breaths. But in one rescuer, there's no need to switch. In 2 rescuers, you switch every 2 minutes. One rescuer is best for like alone. 2 rescuer, like let's say there's a team, you make sure that there's 2 rescuers. Now, moving on to pediatrics, basic life. If I am too fast, please let me know. Let me know. All right. Just type it in the chat box. There's no need to unmute your mic. Now, BLS basic life saving skills. Now, for pediatrics rather, there's compression depth. For the compression depth is 2 in 5 centimeter. Now 2 inches rather, 5 centimeter deep. Now the for children, cardiac arrest is usually caused by breathing problems, not heart problems. So early breaths matter more than in adults. For in the case of one rescuer, is 30 compressions to 2 breaths, and in the case of 2 rescuers, is 15 compressions to 2 breaths. Now, if you have automated external defibrillators for children, you can use. You can use. Just make sure that even if you are using adults, just make sure that they do not touch each other. Like I said, you place one up and down. Now, for infant BLS, that is for children less than 1 year old. For children less than 1 year old, infants are very different. You use 2 fingers instead, unlike the other one whereby you interlace
All right, I guess you are being muted again. You can mute your mic, please. Can you hear me?
Can you hear
The
me?
facility. Okay, yes, you can go ahead now. We can hear you now.
All right. Please, where did I stop? Where did you stop hearing me from?
You can go ahead from
Okay.
where you are, please. All
Okay,
right.
thank you very much. Right, so you make sure that your mouth is covering the mouth and the nose of the infant. And when I say infant BLS, it means a child that is less than 1 year old. Now you're giving gentle puffs, not full adult breath. So make sure that the two rescuer, like I said, one rescuer versus two, the two rescuer ratio is 15 to 2 infants as well. So that is that on basic life saving skills. Now, let us move on to the cardiopulmonary resuscitation, AED, and first aid, how the three are interlocked or interrelated. Now, in first aid, there's something called the three P's. The first one is to preserve life, the second one is to prevent further harm, and the third one is to promote recovery. So these are the three main goals of first aid: preserve life, prevent further harm. When I say preserve life, that means you are keeping the person alive in the case of the emergency. Instead of getting out your phone to take pictures and videos, you are saving the person's life. The second thing is to prevent further harm. That is, you are not making things worse. Let's say there's a patient that has a stab wound now. You are giving first aid and then you're pulling out the knife. Is that what you're supposed to do? No. Position the person, ensure that further harm is not done to the patient. Then the third thing is to promote recovery. That is, you are helping the patient, the person to heal rather. Now, there's something called the primary survey in first aid, the DRABC. Right. Now, the first thing is the danger. You recognize the danger. What is your response? You are securing the airway. You are ensuring that the patient is breathing and then the circulation. I'll go again. Danger response, airway breathing and circulation. DRABC. Now, there are five principles in first aid. Like I said earlier, you're preserving life, you're responding to the emergency, you're caring for the patient, you're evaluating the situation, and you're seeking for help. In every emergency, call for help. Do not try to be the hero. Call for help. Call for help. Now, there are various things that you can do in various emergencies. I'll just explain a few. The first one is in the case of choking. Now, there's something called the Heimlich maneuver. Now, if someone is choking, let's say someone is beside you, you are in a restaurant, you are eating, and then all of a sudden, person start coughing, start eating the chest, and start choking, probably choked on bone or choked on food. The first thing to do is to ensure that you are acting fast. Now, for adults and children over 1 year, you are using abdominal thrust, also called the Heimlich maneuver. So, you stand behind the patient, the person rather. You play like as demonstrated in this picture. You place your fist above the belly button. The belly, we all know belly button, right? Place the fist above the belly button. You interlock your hand, then you pull inward and upward, like as if you are pushing the stomach up. So, but for infants, you do five back blows and five chest thrusts. Never do abdominal thrust on an infant. Never do abdominal thrust on an infant. Now, if the patient, and if the person becomes unresponsive, start CPR immediately. Start CPR immediately. Now, in the case of bleeding control, let's say there's a person beside you, there's an accident, industrial road or domestic accident, so to say, and then you want to stop the bleeding. The first thing to do is to apply pressure. You're applying pressure with a clean cloth, please, not a dirty cloth. You're applying pressure on the bleeding sites. You're applying pressure on the bleeding sites. I hope we are all still with me. Okay, sorry. It's because we have a lot to cover. We have a lot to cover. Sorry, I'll try to slow down. All right. So you apply direct pressure on the place of the wound. And then the next thing that you have to do is elevate. Elevate the injured limb if no fracture is suspected. Let's say it's in a case of fall. If you're saying that there's no fracture, probably the person is not shouting that, oh, I can't carry the leg, I can't carry the leg. You elevate the leg so that the bleeding will at least stop. There'll be like a venous backflow. Now, the next thing is to apply a pressure bandage. Make sure that it is firm, but it is not too tight. Then use a tourniquet. Now a tourniquet is like the last resort in a life-threatening, but let's say the person is bleeding so much, like all this arterial bleed now. The person is bleeding so much. And then if you only use a tourniquet if you are trained to use a tourniquet, please. Then when you use a tourniquet, you're right, because using a tourniquet is like stopping blood flow to that place. And if blood flow is stopped to a particular organ or a particular place for a long time, there will be like death of that particular organ, and then you don't want that to happen because you are just trying to save the person. If you are still with me, please type on the chat box that you are still with me. Thank you. Thank you. All right. Thank you very much. Very good. I believe you're all gaining something. I believe you're all gaining something. Now, there's another situation called the shock and stroke. These things that I'm explaining to you are I would say common situations that you can experience in our day-to-day activities. There are common situations that you can experience. Now, in the case of
Hello, excuse
shock
me,
or stroke,
please. Hello, hello.
please, if you have a comment, please type in the chat box.
We are not hearing you.
If you have a comment, put it in the chat box. Thank you. Now, in the case of shock and stroke, now it is very essential to know shock signs. Now, shock usually results from blood loss or heart failure. Now, there are various kinds of shock, but I will not go into that today because of our time. There's no time to go into that because a bit on the clock. So now, but the things that you can know is the shock signs. The first sign is the patient becomes pale. The patient becomes pale. In a case of please mute your mic. The patient becomes pale. The patient becomes pale. Now, another thing is that the patient will have a clammy skin, a cold and clammy skin, and then there will be a weak, rapid pulse. I believe we all know how to check a pulse. You can check it on the neck, you can check the brachial pulse, you can check the radial pulse. But then the person will have like a weak pulse. Please mute your mic. Mute your mic. Gabriel Miracle, kindly mute your mic, please. Thank you. Then now what do you do in a case of shock and stroke? You lay the person flat and you ensure that they are kept warm. Keep them warm. Then now for stroke, there's an acronym. I call it FAST. FAST. When you see the face drooping, arm weakness, like the person cannot carry their arm anymore, then the person cannot talk anymore, then you see that it is time to call emergency. Then it's like it is an urgent situation. The person has to get to the hospital fast. Just make sure that in case and when you see signs like this, ensure that the patient does not fall because a fall can worsen the situation. Right? A fall can worsen the situation. So just ensure that the person does not fall. So if you see a situation, oh, all of a sudden the person's face is drooping, and then they call it facial palsy. So person's face is drooping, then the person cannot carry their arm all of a sudden. Then they are trying to talk, they're like blah, blah, blah. They can't talk normally. Then you see that it's time. So these are like the four signs that you will see in a person that has a warning sign of stroke. I believe you are all still with me. Please, if you are with me. Oh, you can't see my screen? Please, if you can see my screen, let me know. Can you all see my screen, please? All right, very good. Thank you. Okay, so now let's move on to infection prevention and control. All these things that I'm saying are they are things that you need to know. Things that you need to know. Please, if you are just joining in, please make sure that you are muting your mic. Mute your mic, please. Mute your mic, please. Thank you. Now, infection prevention and control. What is infection prevention and control? Infection prevention and control are just basically like everything that we do to stop infection from spreading. Now, you do it at home, hospitals, clinic, or even in the field during first aid. Let's say you are encountering a patient or a person. Now, say the person is having serious bleeding, and then you are carrying a dirty cloth to apply pressure. You are introducing infection into that wound. So, infection prevention and control is very, very important in administering first aid to a person because it protects you, it protects the patient, and it protects every single person around you. Now, there's something called the chain of infection. Infection basically spreads through a chain and it is from one place to the other, one place to the other, one place to the other. Please, if you're just joining, mute your mic. Lavinia, please kindly mute your mic. All right. So now, the chain of infection includes, I would say, five or six. Now, for every infection, there is an infectious agent. I want you to get that. For every infection, there is an infectious agent. And for every infectious agent thrive in a reservoir. Every infectious agent thrive in a reservoir. And for every infectious agent to actively infect someone, there has to be an exit. There has to be an exit. We call it the portal of exit. Portal of exit. Portal of exit. Now, an example of portal of exit is coughing. Please mute your mic. Now, after the portal of exit, there's something called the mode of transmission. I would give a very good example after explaining this. Then there's an entry to susceptibles. Now I'm going to use COVID-19 as an example. Please, if you know COVID-19, kindly type in the chat box. How many of you know COVID-19? All right, very good. So now COVID-19 is they call it coronavirus. So it's a virus. Now it has a reservoir. The reservoir is like the human where it is. Now it has a portal of exit. They said it was transmitted through coughing, that is the droplet of coughing, sweat, and all. That's the portal of exit. Now, transmission is, let's say someone touches you, someone with COVID-19 that is sweating a lot, touches a person. That's the mode of transmission. Now, entry to a susceptible host, they told us back then, use nose masks, use this, use that, and then you are refusing to use it, then you are a susceptible host. It enters, and then the person contacts COVID-19. We understand that illustration. If you understand, kindly type in the chat box that you understand that illustration. Do we understand? Very good. Very good. Now, there are standard precautions that you need to always carry out whenever you are in the infection prevention control procedure. The first thing to do is hand hygiene. That is, you wash your hand. You wash your hand. Hand hygiene. Wash your hand every time. There are 5 moments. I will explain it after this, where you have to wash your hand. Then use PPE, that's personal protective equipment, the gloves, the masks, the gown, and then goggles. Then safe injection practices. That is if you are licensed to give injection. Respiratory hygiene and waste disposal. Now, according to WHO, there are 5 moments for hygiene. 5 moments for hand hygiene. Number one, before touching a patient, let's say you are in a critical scenario, before touching anyone, please wash your hands so that you do not transfer, because there are some opportunistic bacteria that live on our hands. The moment they enter a wound, they become fatal rather, to the person that it is introduced into. One, before touching a patient. Two, before clean and aseptic procedure. Three, after body fluid exposure risk. Four, after touching a patient. And then five, after touching the patient's surroundings. Please, if you have your notes and you book with you, I would stay on this slide for a while. I want you to write these 5 moments down. They are very, very important. Before touching a patient, before clean procedure, after body fluid exposure risk, after touching a patient, and after touching a patient's surroundings. Now, all right, so I think I've given time to do that. I believe we all know how to wash our hands. Now, PPE done and Dove summary. To don a PPE, you wear your gown first, your mask, the goggles, then the gloves. Do not make the mistake of wearing your gloves at first. And number two, to doff your PPE, you remove your gloves first, your gown, your goggles, your mask, and then you do hand hygiene. I'll repeat again. To don your PPE, you wear your gown first, the mask, the goggles, and the gloves. Then to doff the PPE, that is to remove the PPE, you remove the gloves, the gown, the goggles, the mask, and then you do the hand hygiene. All right. Please make sure you're writing it down. Now, make sure. All right, please. Very good. Now, now there's something called waste color coding, because of course when you are dealing with first aid, you are going to discard waste. Now, a general waste goes into a black nylon. There's like a black nylon. It's for general waste. Infectious waste goes into the yellow nylon. Highly infectious, that is all these blood, um say something like it's very bloody, it goes into the highly infectious pack. And then sharps goes into the sharp box. There's something called the sharp box. You would have seen it, they wrote it on it, sharp box. So sharps like needles, anything needle that would harm anybody, just make sure that it goes into the sharp box. I hope I'm writing this down. Okay, so now we move on to unit. Okay, I hope we are all written that down. Very good. And I believe, please, if you don't understand the parts, just let me know so that I would be able to come again. If you need me to come again in some parts, please let me know. Okay, now for waste color coding, there's something called waste color coding. Now, the general waste, that is all these wrappers and all. Let's say you open a bandage now, the wrapper goes into the general waste bin, and the general waste bin is always black in color. Wrapper goes into the general waste bin, always usually black in color, right? Then the infectious waste go into the yellow waste bin. Now and the third, that is highly infectious. That is highly infectious means that things that can, like, infect or affect other people around. Highly infectious will go into the red pack, the red line rather, or the red packet, whatever it is that is sharing. Make sure that it is highly infectious, like inside. Then sharps, anything that can harm the patient or anybody around you, like needles, they go into the safety box. Now, let's move on to pharmacology for first aiders. Now, not every first aider can give every drug, but there are certain drugs that can be given by first aiders. And again, not every drug can be given by a first aider, but there are certain drugs that can be given by a first aider. Now, a first aider can assist with inhalers, like what is salbutamol inhalers for patients with asthma. You can assist with glucose, epinephrine, auto injector. Then you can also monitor for side effects. Now, as a first aider, don't say because you don't have certificate as a first aider, you go on with prescribing drugs. No, you do not prescribe. You do not inject. Like I said earlier, you do not give injections unless you are trained. Please do not go and harm the patient because giving injection in the wrong part can um, cause an abscess. It can cause an abscess. Okay, can you all hear me? Can you all hear
Yes,
me
ma'am.
now?
Yes.
All right.
Your
Yes,
voice
we,
is
yes,
not
we
loud
are
though.
with you.
Okay, I'll try my best to increase
Yes, ma,
the
we
sound of
can.
my
It
voice.
was breaking on there, number. We can't hear you now.
All right, thank you. Now, I will come
Please,
again.
I can't hear you.
Can you all hear me now? Please, if you can hear me, just type in the chat box so you can hear me.
Understand what you're saying. It's like you are, I don't know.
We are hearing you.
Okay, very good. Thank you. Okay, now I would come again. I
I can
said
hear you like
that
1%, just 1%.
Something. Something. Speak
can
out.
you all hear me now?
Loud and
Hello, everyone. Can you hear me
Yes.
now?
Yes,
You
we
can
can
Maybe
go
hear
the
you.
ahead.
Go
network
on,
issue.
go
Trying
on.
to
Don't
find
worry.
Okay,
the
Go
thank
on.
you. So
Yes, we
now,
can hear you.
like I said, first aiders role with medication. A first aider can assist with inhaler, glucose, and epinephrine auto-injector, and then you can monitor for side effects. Now, don't say because you have a first aid certificate and then you go around prescribing drugs. You are not a doctor, neither are you a nurse. There's a limit to what you can do. You just assist with the things that are inside the first aid box. You do not prescribe drugs. Number two, you do not inject unless you are trained. Giving injection in the wrong part can cause an abscess and then you can cause paralysis to the person that you are assisting. And know that in first aid you are trying to preserve life, you are trying to promote health, you are not trying to kill the patient. So do not prescribe and do not inject unless you are trained, and you do not diagnose, you just provide help. You are not a doctor, you are not a certified medical practitioner, you are a first aider. First aid means providing help when it is needed and when it can help and promote the health of whoever it is that you are assisting. So do not diagnose, do not say, oh, I think the person has a fracture. Whereas the person does, you've not done x-ray, you've not done anything, and you are not even certified to do that. So you do not diagnose. But you can assist with all this salbutamol inhaler um um for asthma patients. Yes, asthma patients. Now let's move on to the next slide because our time is fast spent and we still have quite a lot to cover. Now, there are various common emergency medications. I will just list a few. And now, the first one is aspirin. Aspirin is usually given in the case of a suspected heart attack. Yes, you give aspirin. Just make sure that it is chewable. The patient chews on it and then they feel better until help arrives. Then you can also administer oxygen in case of a patient having respiratory distress. Let's say someone like you can hear the wheezing, you can hear that the person is not breathing well. You can administer oxygen, and that is if oxygen is on ground. Then you can also give glucose gel that is for a patient or someone that is conscious, and then you've seen that the person has low blood sugar. And by the way, to test for blood sugar level, you use the glucometer. Yes, the glucometer. I think probably I will send the organization will send the picture to you. to know what a glucometer, or you can just check it online. I think I'll just type it in the chat box so you can see what I'm talking about. You can just search for it online. I've typed it in the chat box, a glucometer. You can use to check the blood sugar level. Then in the case of anaphylaxis, now the anaphylaxis means okay, let me give a scenario. Let's say there's a person that does not eat peanuts, and then the person eats the nuts. The person begins to react, and that reaction is called anaphylaxis. Now, if the person is not well taken care of, the person can go into something called anaphylactic shock. So, in most people that react to things like that, they carry something called an EpiPen, and that EpiPen it contains epinephrine. So one shot will make them calm down, and then you can get them to the hospital for adequate care and rest. Now, in the case of asthma attack, like I said earlier, there's something called the salbutamol inhaler. How many of us know people that have asthma that there's one small thing that they used to carry around that they'll just puff into their mouth? If you know it, please type in the chat box. If you know it, just type it in the chat box. Let me see. Okay, very good. So there's something that they carry around. They carry it around. They used to like pop it into their mouth. So there are actually different types. But for most of the one that is usually readily available in the first aid pack is the salbutamol inhaler. A salbutamol inhaler. So in the case where you are suspecting asthma, you give puff. You give the puff. So now again, I believe you can all see my screen. So I explained something called anaphylaxis. Now, someone asked, what's the difference between anaphylaxis and allergic reaction? It depends on the context you're talking about. There's some people that they will just sleep on something and then their body, their skin starts itching and all. Anaphylaxis is way bigger than that, right? And these are the signs. When you see anaphylaxis, the first sign is the person begins to swell, like the scenario that I explained earlier. The person does not eat peanuts, and then the person all of a sudden, maybe somebody snuck peanuts inside the person's food to do bad for the person, right? Maybe like to harm the person, and then the person eats the nuts unknowingly. Now, the first time you see, most of the time is always on the face. The face starts swelling up, and swelling up, and then they will be wheezing. Now, I don't know if you'll be able to hear me, but wheezing is basically when somebody is breathing and you hear the way they are breathing, like that's how they begin to breathe. Like you can hear the way the air is going into their lungs. So that's basically what they call wheezing. Wheezing, like you can hear the way the air. And normally, if someone is breathing beside you, are you supposed to hear? Yes or no? If a normal person is breathing beside you, are you supposed to hear? No.
No.
Very good. So if you can see that the person beside me, maybe the person just finished eating something beside you, and then the person is beginning to wheeze like, what's going on? You know that there's an emergency. It could be an anaphylactic emergency. And then after the whole wheezing and the person's face are puffed up, and then the person collapsed, like the person fainted. What's going on? What do you do first? I said that the first thing to do in the first aid is what? Please type in the chat box. What's the first thing to do? First aid. I've said it earlier. You call for help. You call for help. You do not just give EpiPen immediately. You call for help. That is the first thing to do in the case of any emergency. Call for help, because there are ethical dilemmas to these things. You have to be very careful. You have to be very careful, because if there's nobody with you now, and then you go and do the wrong thing, and then something happens to the person, who will do the jail time? Nobody will hear that you are just trying to help. So just call for help. Call for help. And then you call the emergency services. No matter where it is that you are, make sure that you have the number of emergency services, whether you're in Nigeria or you're in diaspora, you're in the UK, you're in the US, you're in Korea, you're in Canada, wherever it is you are, make sure you know the the number of emergency services. Now, number two, you search around. Most people that used to have reactions like that, they used to carry their EpiPen around, also called the epinephrine auto-injector. So, like, look at the image that I'm projecting. You can see that the person is injecting it into the thigh. You don't need to remove cloth or anything, just give like that. I am intramuscular, give, and then you lie the person flat. Lie the person flat. And if you say that the person is losing consciousness, you give cardiopulmonary resuscitation. That is also called the CPR if needed. Now, when administering medication, there are different rights that you need to know. Please, if you are with your pen and your paper, you need to write this down. If you did not get anything today, in fact, I know you will have gained something by the way. But please, this is very, very important. Very important. And you need to know this to ensure that you are not doing the wrong thing to the patient. Now, the first thing is the right patient. Before you, okay, let's say there's an anaphylactic emergency. Before you give anything, make sure that the EpiPen you are using for the person is right for the person that you're using it for. There is always a name on it. Oh, is this the person? Oh, yeah, she's the one. Now, right drug. You do not give insulin to somebody that is having a reaction. Insulin is to lower sugar level, and then you are giving it to someone that is having a reaction. Are they the same? Please type in the chat box. Are they the same? No. Very good. So you make sure that you are giving the right drug to the person. You are giving the right drug to the person. Now, the next thing is to ensure that you are giving the right dose to the patient. You do not give, let's say, a person is having pain, and then you are authorized to give injection. Let's say paracetamol, that's PCM injection, and then you were instructed give paracetamol 600 milligram, and then you want to give paracetamol 900 milligram. Is that the right dose? No, it's more like as if you want to kill the person. So you make sure you're giving the right dose for everything that is going on with the patient. Now, right route. Look at this anaphylactic emergency. Where is the person inserting the EpiPen? Please type in the comment box. Where is the person inserting the EpiPen?
Hi.
Very good. So the person is inserting it in the thigh. Is the person inserting it in the mouth?
Hi.
No, not inside the mouth. So in the case of every dog that you are giving, you are to give in the right route. You do not give an oral drug, a drug that is being used by mouth, and then insert it to the anus. No, you do not do that. Ensure that you are giving it to the route, and there are different routes to give medication. Like we have the oral, that one is the one that we swallow, We have the intravenous. That's what most people they'll say drip, 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 drip. The intravenous is given through the vein. We have the intramuscular. This one is an example of intramuscular. This one that is being given into the thigh that I'm projecting right now is intramuscular. There's one that is given through intranasal. That one is this that vein salbutamol inhaler. And then oxygen is also intranasal. Oxygen is also something that helps the patient to recover. So it is intranasal. Now, right time, right time, right time. Each drug have there's a time you do not okay. Now let's say a patient is having pain and you want to give paracetamol. You've given paracetamol 1 a, and then you run again. The patient is having pain. You give paracetamol 1:30 a.m. Please, it's 30 minutes interval, not too short. Please mute your mic. Please mute your mic. Please do not interrupt the class. Mute your mic. All right. So it's 30 minutes interval, not too short. You ensure that you are giving a right drug at the right time. Now, the last but not least is right documentation. Right documentation. For everything that you do, please, if you are providing help as a first aider, ensure that you are writing everything down. you are documenting. Oh, at this also time, I give the person epinephrine. Oh, at this also time, I did CPR. Oh, at this also time, I did this. Because anything not written is not done. And then let's say you're not trying to defend yourself. Oh, I did this for the person. Okay, where did you write it down? Okay, let me see where you wrote it down. Oh, the thing where was real there. I didn't remember. Nobody will hear that. So ensure that you do the right documentation. Now, moving on. I have just about 30 minutes left. BLS, that is basic life saving skill, is a combination of cardiopulmonary resuscitation, CPR, AED, automated external defibrillation, and chain of survival. Now, I mentioned in the first aid is the 3Ps plus DRABC. Now, let's move to the back. Now, what are the 3Ps? Preserve life, prevent further harm, promote recovery. Those are the 3Ps in first aid: preserve life, prevent further harm, and promote recovery. And I said first aid is the 3Ps plus DRABC. So the DRABC is the danger response, airway breathing, and circulation. You recognize the danger, you respond, then you ensure airway. Oh, that is that part where I talked about giving rescue birth. Ensure that the airway is secured. The person air is entering the person's body, and then breathing and circulation. Then moving on, we also spoke about infection control. That is, infection control can be done through hand hygiene, PPE, and waste segregation. I already explained waste segregation and the color coding for waste. And then I spoke about emergency drugs, where you, as a first aider, you assist, you monitor, and you do not prescribe. And like I always say, any attempt is better than none, please. Any attempt is better than none. Any attempt is better than none. Please, if you cannot hear me, I will think it's your network because I believe everybody can hear me, right? What's going on?
Yes, we can
Okay,
hear you.
thank you. So
Yes, we can hear
now,
you.
any attempt is better than none. Please, I don't know, especially in
We
some
hear you
countries. I'm not going to
wonderful.
mention. Thank you, thank you. There are some countries that accidents will happen, and then you're carrying your phone to make videos. Please, as a normal human, what are you supposed to do? You're supposed to provide help. You're supposed to swing into action because the time that you're using
हमारा अब ले लो अपना पिंक बलून
Okay, so please make sure that these things that you're learning are not for joke, they're not for play. The certificate is not for play. If you see any emergency, be it at home, be it on the road, be it at work, in the hospital, or anywhere you find yourself, make sure that you try to save and preserve life. So thank you very much, everyone, for listening. So now I'll be opening the floor. We have about 20 minutes left. So please, if you have questions, there's no need to unmute your mic. Just type it in the chat box and I will address them one by one.
All right, thank you so much, the facilitator. Can you hear me?
Yes, I can.
Okay, thank you so much once again for the beautiful presentation. I believe every one of us, as all participants, has been able to put together with what they've learned on their respective groups. I believe they have been able to put everything together and be able to learn one or two things. So just like what she said, the floor will be opened for questions. You can ask questions about the certificate, ask questions about the subject, not outside the subject. What she taught, not outside the subject. So if you have your question, just go to the chat box, drop your question there. And also, if you have a question where you want to express yourself, you can just raise your hand. Just raise your hand. So you'll be called upon and you'll be called to unmute your mic. So please don't unmute your mic. If you unmute your mic, unless you are told to do so, you are going to be removed immediately. So just raise your hand or type your question in the chat box. So thank you so much. So I will be paying attention to those people that raise their hand. I will call upon you, tell you to unmute your mic. While I believe she's checking those people that ask questions on the chat box. So to go with, I have 6 people have already raised their hands now. 7. I have Ijege Clement. You can unmute your mic now. If you are with us, you can unmute your mic. Ijege Clement.
Thank you very much, sir.
You're welcome.
Man, it's a question that I want to ask. I really enjoyed the class today. So I had an experience sometime before this class. So in a case where a victim of a road traffic accident is jerking, and at the same time the person is unconscious, what should be the first approach to save such a victim?
Right. Thank you very much for the question. Is that all? Is that all before I answer? Clement,
Yes,
can
yes,
you hear me?
that's one.
Okay.
Yes,
Now,
yes, I can
in the
hear you.
case of seizures, I said jerking rather. A jerking could be a seizure. And seizure can arise from a lot of things, a lot of things. It could be as a result of head injury, that is like the impact that was caused to the head during the in the course of the road traffic accident, and it can lead to a seizure. Now, in the case of seizure, what you do is that you clear the area. First of all, you clear the area. Do not hold the patient down, and don't put anything in their mouth. There are some people that what they do next, whenever they see a person with seizure, they start looking for hand or spoon or something. Do not put anything in their mouth, and don't try to stop the checking. Allow the seizure phase to pass. Just so that you have cleared the area, so that the time where they are checking and they're having that seizure, they will not be injured again, right? They will not be injured again. Now, the thing is that most seizure they will last, let's say, about 30 seconds to 2 minutes. So the moment the jerking stops, the first thing that you're supposed to do is check. You said the patient is unconscious. Check responsiveness and breathing. And if the patient is still unconscious and you can see that person is not still responding, you can start the CPR. And then you keep checking the breathing, keep checking the pulse, and then call the emergency services immediately. But what to do is that don't hold the person, let the check-in take its course and stop before you start the intervention. Thank you.
Thank you very much, man.
That's
Any other question?
Thank you so much for that, our facilitator. Let's go ahead with the second person. Now mean Sambo. If you have asked your question, just lower your hand so we can know that you are done asking your question. So Naomi Sambo, you can go ahead now. And you will only be accepting about 6 questions. Others, you can go to the chat box and drop your questions, please. Because of our time, you can't just be talking and talking. We have other things. You are still going to do your test tonight. You are still going to start paying for your certificate tonight. So we have to ensure that we maximize the use of our time. So now, Miss Sambo, you can go ahead now. You can meet your mic and ask your question.
Thank you very much, Ma, for this wonderful presentation. Like in the hospital setup, a patient is having seizure. He will be on the bed quite all right. But you will see they will rush and say, please get diazepam and give immediately. The patient start. Is it wrong or is correct for them to give that diazepam in the hospital setup?
Okay. Thank you very much. It is not wrong. It is they give the diazepam when they are very sure that the person is having seizure compared to when it is outside. So the diazepam is like a muscle relaxant, basically. And when they are giving the diazepam, you give it slowly, but that is given in the hospital setting. In the hospital setting. So yes, you are actually right, and they are not wrong. Diazepam is indeed mostly used in the case of seizures. It's a muscle relaxant. Thank you. Any other question? Have I answered your question?
Yes, ma. Yes, ma.
Thank you. Thank you.
All right. Thank you so much for that. Chizom O Cheji. Chizom, are you with us?
Yes, I'm with you.
Okay. You can go ahead now.
I have three questions.
Okay.
The first one is concerning the certificate. You
Okay.
mentioned that you're going to pay for the certificate, but from the beginning of when you started this your program, you said okay that it is free. So
Okay.
in a situation where the person has been up and active in the section and assignments, but the person is unable to pay for the certificate. Are you saying that okay, the person will not be given free of the certificate because she didn't
Okay.
pay? And my
Okay.
second question is, you at the ending of this class, the lady mentioned that if you're in any situation where there is a program concerning maybe accident and so on, in a situation where you decide to attend to an accident that just occurred and maybe you want to help, like she said that you should not overlook things, like you should go on and help. And at that point, you now go and help. In that situation, maybe the person you're trying to help die at that situation. Maybe you want to like check his pulse, want to check his breathing or whatever to know if he's responding. At that situation, you're doing that, the person now die because of the accident that he has. And in that scenario now, you have people around. I've witnessed some people when they do something like this, the patient or whoever, the person dies, then they will now hold that person responsible. And you don't have license. Let's say that person does not have license, it's not a nurse, it's not maybe due to the experience training he has had before, then he wants to come and attend and help, maybe check his breathing and everything. At that point, the person and dies. Then they'll hold the person responsible, like those people around hold the person responsible and maybe take the person to court, or maybe carry the person with the dead body and say, okay, because you touched this, you touched the person, and maybe to them they might say you touched the wrong thing in the process of trying to help. And we are in Nigeria, and this kind of scenario like this, nobody cares who you are. So far you have touched that person's body, so they can hold you responsible of what happened to that person. So because me, I've seen a case like that on the road, and they had to take the person. So I don't know whether it's police. They had to call police or something to carry that person with the dead body because he touched and tried to attend to the person. And the worst was that he didn't have license. So she saying, our moderator, the woman saying that we need to attempt, no matter how, we just try and do something. That point is going to be very, very difficult because we are in Nigeria. It's not abroad. Because I know if it's abroad, they would look at it and say, okay, the court or the lawyer might say, yes, she was trying to help. But in Nigeria system like this, nobody is looking at that, and they don't care about if it's you're trying to help or not. So my third question is that this program that we started, I'm happy that because I've learned a lot, and it's very that's help. It's good that it's helping a lot of people who don't know the safety and precautions of what to do. So my third question is this breathing, like now, for example, now you're in a scenario where you're outside and there's a someone that needs airway, because some people feel that if they are trying to do this ABC, that is air and breathing and circulation, maybe you're trying to put air into that person's mouth. Some people don't want to be using their mouth and be doing it, and you don't know if that person has HIV or if that person have an infection. So in a scenario where you're trying to check the person's air, how are you going to do about the airway? Because you're in a scenario where there is no maybe an instrument to use, or there's no, maybe because some people might use like water bottle now, they just cut it into two and use it as funnel to put and do an airway. So if you're in a scenario where there's nothing like that in that environment, what are you going to do? Because you can't just only check the breathing and circulation, you need to also give the person air, breathe in air, put an air into the person, that is, they say mouth to mouth. So you don't know if that person is having an HIV or is infection or whatever. So in that scenario, what are you going to do? Thank you.
Okay, all right. Thank you so much, Ma. We are going to paint the answering the question so that we will not delay the facilitator. No, she is going to answer number 2 and number 3. So every question regarding certificates, those things will be responded to later, so that we can maximize the use of our time. So you can go ahead, Ma. Just you try to pay attention to the second question she asked, and also the third question she asked, and you can go ahead now. The facilitator, you can go ahead now. Are you with us? I'm not sure she is with us.
Yes, yes, yes. Yes, I
Okay,
am.
you can.
I'm with you. Okay, so I understand your point where you said that, oh, we're in Nigeria, ethical dilemmas and all, and that is why I always emphasized on the part of calling for help. You don't do things alone, and I also emphasized on documentation. You document every single thing that you did, because that is what is going to help you, right? And if
Are you with us? I think the network is not so good at our side. Are
give,
you with us? Okay, go ahead now.
yes, I am, to do or to give. So what we do basically is, in case where you can't give rescue breath, just do the case of two rescuers. As you are doing the compressions, they are giving rescue breath. Now, if you can't give rescue breath, there's something called an ambu bag. An ambu bag in every first aid bag. An ambu bag is always like present in it. So when you can't give mouth to mouth, you use the ambu bag instead to provide the oxygen to the person. You and then you call for help and ensure that whoever it is that you are providing first aid to, make sure that there's someone as a witness, so that at the end of the day nobody will come to me to that, oh, you killed someone or you did something, because everybody will see the gravity of the situation. Thank you.
Sorry.
All right, thank you so much for
I,
that. I believe you are able to pick something.
yes, but
Yeah,
sorry for to she mentioned ample bag. And my third question was like, sorry, my third question
how do
was
you
like,
assess the year we like?
yeah, the ample
Uh,
bag is not, my scenario I said is you're in a situation where you can't see an ample bag, because it's not everybody that know. You can't say I need. I'm not talking of being in the hospital or this one. You are on the road, like you are in. It's in a place where there's nothing like that. You don't, like I said, there's nothing like water bottle. You can't see anything like amber bag. It's on the road. This accident occur. It's not that you don't see anything like amber bag or water bottle. So I was thinking maybe she will say something like, because it just occurred to me, I just remember, like maybe something like sachet water, no, pure water. Some people, I
No,
don't
no,
know,
no, 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 no.
use
In a case
then what are
where
you
you
going to
can't,
use?
in a case where you can't do mouth to mouth because of this situation, or there's no ample bag, just keep doing the CPR. Just keep giving the CPR until help arrives or until the person shows signs of life. Just keep giving the CPR. Just keep giving the CPR. Just keep doing the chest compressions because you are right. We do not want to contact another thing in the aim of giving first aid. Just keep giving CPR. Just and make sure that there's interval in between the CPR. Just make sure that you don't stop until the person wakes up. In a case where you can do mouth to mouth and then ample bag is not available.
All right, thank you so much for that. I believe you are so convinced about that response. Okay, just we are going to take in two more questions before we round up the session tonight. On Sammy, you can mute your mic, then followed by Chiamaka. Those are the two people that we are going to we are going to permit to ask more questions before we end this session tonight. Sammy, you can mute your mic now.
Good evening, sir.
Good evening. Good evening. Go
Please,
ahead.
I appreciate the facilitator, Lauren. Thank you so much, man. Big thumbs up. Going straight to the point, can a video clip be made for this? Because most of us here are students, so even it's not permitting us having a screen record because we having the screen record, the voices are not being recorded. Please, if a video record can be made, then posted in our group, I would really appreciate that. Thank you.
Okay, thank you so much. We have a video. I think the IT team should be able to do something on that. There is a video recording going on. Let's see if they can be able to bring that out and send it across to all groups. Thank you so much for that.
I appreciate.
Franca, do you have any other question? Franca, yeah, I think he's not with us. So now, thank you so much once again. We want to appreciate our
Sorry, I'm
facility.
with you. I'm with you. Sorry. Good evening. Good
Good
evening. Good
evening.
evening. Sorry. Um, Thank you very much, Ma, for the presentation. Even though I came late, I joined late. I grabbed one or two. Thank you so much. Now, my question is this CPR. Okay, let me present a scenario. I was in the hospital one day and the man was rushed in, even though I wasn't aware immediately when they rushed him in. But when I learned that there was an emergency, I hurriedly went there and the nurse attending to the patient just told me, I think he's gone. I said, is that all you can say? Have you even checked? Have you even tried the CPR room? She said no. So I did some compressions. Even can you hear me, please? Hello.
Yes, you
Yes.
can go ahead. You can go ahead.
Okay, thank you.
Go ahead.
So I gave some compressions. So I as at that time I actually did not have good knowledge about CPR anyways, but I just doing my best. But in the course of doing the CPR, the man actually um breathed like he responded. He responded, and then I was actually asking the nurse to give me a dose of what is this? What is this drug again? I've forgotten this injection. But as at that time, there was none. I don't know what I did wrong,
I do.
because when I did that compression, the man actually responded, but eventually we lost him. But I don't know where I got it wrong.
Is that your
Is
question?
that
You
all?
can unmute your mic.
Yes.
Okay, thank you. Please mute your mic. Thank you.
All right. Do you have what to say? Do you have anything to say to that? Statement?
Yeah.
Not even getting what
If
they're
you are,
saying.
Yes, please.
please,
Um,
if you are just
there are
joining
different.
us or you have been in the session, please hold on. You have been in the session for a while and you already know that you are expected to mute your mic unless you are told to unmute your mic. So please, everyone should mute their mic. It's for the purpose of decorum and so that everyone can learn one or two things. And some of these things that we are doing are things that some of us, some people are professionals, medical professionals, or health practitioners. Why some are just lay people, they don't know anything about it. So if you are not paying attention, you are not muting our mic, it's going to be affecting other people. So thank you so much. You can go ahead, our facilitator now.
Okay, thank you very much. You didn't do anything wrong. I mean, I will just even applaud the fact that you stepped in to the situation bravely. But different people come to the hospital with different conditions. So it's possible that the condition of the person was already very, very critical, and um, I mean, you were giving all the CPR, you were only giving CPR, and nothing else was being done to that particular person, despite the fact that he or she was in the hospital. So it's possible that the person might have been in a very critical condition before, I mean, when you arrived at the scene. So it's not like you did anything wrong. Instead, you bravely stepped up to the situation. So you didn't do anything wrong.
Okay, thank you so much. I believe you have gotten that. So the patient, oh sorry, the person or a patient is in a very critical condition. The person may not likely survive. So that's what actually caused that. So thank you so much once again, everyone. We want to appreciate our facilitator for doing a very good job to summarize a lengthy lecture, and she summarized it in a way that everybody could get one or two things and they could learn one or two things. Thank you so much once again. And also want to appreciate all our participants, those that were able to join the session. We have many other people out there that were not able to join the session. Please, you can mute your mic. Many people, but you are here. We want to appreciate you for ensuring that you don't miss the session, that you ensure that you are around. Now, going ahead to questions regarding the certificate, some people have been asking questions in the chat box. The first person that asked question regarding it said that it was free. Then how come questions about certificates? How come is it coming up? No, of course, the training, if you have been joining our training for a while now, we have some people that have been joining our training for a while. They always know that what we do is free trainings. Then certificate is optional. That means you have opportunity, if you want to pay for certificate, you can pay for it. If you don't want to pay, you may not pay for it. Of course, organizing the training takes a lot. Organizing the training takes a lot. It's not something that maybe you are just here, it is free from your side, but from the organization it's not free. But that is not actually the issue. That's from the organization policy and what they want to do. So the certificate is optional, means you can choose to pay for it, you can choose not to pay for it. But of course, you know the reason why you should pay for the certificate. You know the reason why you should pay for the certificate. Somebody was asking, what is the certificate recognized? Yes. If you check the organization, if you check online, if you check the organization, you will see that the organization is a recognized institution. It is recognized with American Council of Training and Development, that's ACTD. It's also registered with CPD, that's Continuous Professional Development. It's also registered with International Standard Organization, that's ISO. and it's also in partnership or a member of Association of Healthcare Trainers. So, and it's very, very important for you to know that the organization is not just focusing on healthcare trainings. Of course, this if you check, you will see, if you check the website of the organization, you see that the organization have many other services like business management and consultancy. We have leadership and personal development. We also offer trainings. We offer trainings on what's it called, ICT, information communication and technology, software development, and all that. So you are here because this is one of our core areas, healthcare courses. So that's why you are here today. So, and that's just how it works. That's how it was. Also, too, there's also very, very important for you to know that the organization you are also has a learning management system. Learning management system simply means a page where you can always go to study. Means as you are enrolling for this course now, as you enroll for this course now, for those people that pay, actually those people that pay for the certificate, they are going to be registered on the organization website, learning websites. In that place, you are going to have access to the courses again. You can go through the courses again. Then after you are done, you download your certificate. It's also very, very important for you that your certificate can always be verified by the third party. It means if anybody is in anywhere, any place, you should just type your certificate number or scan it. In fact, it's going to bring out your certificates for them. That certificate that you submitted to them is what is going to bring out for them. Of course, it's not, you can't just go to anywhere. The organization have a link where you can do that. So if you need that, just reach out to your facilitator. Please, can I get the organization verification link, and just put your certificate number there, then you are good to go. So that's how it works. That's how the organization works. Again, the organization is New Global Service. If you check it, you see that the organization is recognized. So thank you so much once again. We want to appreciate our facilitator, our training providers, and everyone that has made this training
Sorry,
to
sir. Sorry,
come
sir.
to.
How much is this
Okay.
certificate you are talking about?
When you go back to your classes, it's going to be communicated. Are you getting me? So just
Okay,
go to
sir.
your
Thank you,
classes.
sir.
Everything, go back to your classes. It's going to be communicated. So thank you so much once again, and have a wonderful night rest.
Thank you very much. God bless you.
Thank you. God bless you and all the organizers.
Thank you so
Thank
much. God
you.
Thank you
bless
very
you.
God bless
much.
you so much. And bye.
God bless.
Thank you very
Thank
Thank
you.
much.
Dean
you.
and Ira appreciated.
Bye.
Organizers, we are
Thank you very
grateful
Thank you
very much. Good
Bye.
night.
Thank you very much. We appreciate. Thank you. Thank